Big news about the COVID-19 vaccines. There are now 3 of them. Our medical expert, Dr. Payal Kohli, joins us. It's so good to see you, Doc, looking fabulous as always. Now, we know you've already gotten your vaccine, but we really want to know, if you had to choose one now, which of the 3 would you choose?
That is $1 million question, Tori. But before I give you my answer, I want to hear your answers. So which ones would you guys choose right now based on what you know?
Pfizer for me, only because it's been studied more, even though it's 2 shots as opposed to the Johnson & Johnson.
I say Pfizer because my dad got Pfizer and he was fine. My mom had symptoms after she got the Moderna one, but I don't know.
Oh, I hold stock in Moderna, so Moderna. Best one ever.
So none of you guys picked Johnson & Johnson? I'm a little bit disappointed to hear that.
I know.
Trust it. Not yet.
Well, so let me just tell you something about Johnson & Johnson. In fact, the technology that the Johnson & Johnson vaccine uses has been around substantially longer than either Pfizer or Moderna, which is actually a much newer technology. In fact, the data from Johnson & Johnson has over 193,000 patients historically that have received this type of technology vaccine and other vaccines such as Ebola. So my answer is, you guys, I would choose any of them. Whichever one was first made available to me, that's what I'm telling my family members to do. Because if you look at the numbers, I call it number soup because there's so many numbers about efficacy floating around, but really 2 numbers that matter. How good is it at preventing serious illness? And this Johnson & Johnson vaccine is 85% compared to Moderna and Pfizer, which are about 94%. And then second, how good is it at keeping me out of the hospital, keeping me out of the ICU, and keeping me alive? Because if I get the virus, it's more likely to be something that I, recover from at home. And it's 100% effective at doing that, just like the others.
Well, she was a trick question.
Yeah, so like I said, Johnson & Johnson.
Johnson & Johnson.
Always had my vote.
Right.
And Doc, the Johnson & Johnson, if I'm correct, is just 1 shot, right?
It's 1 shot, Al. That's one of the big advantages. It's much more stable, and so you don't have as many preservatives. You're not having as many allergic reactions either. So from a public health perspective, it's tremendous because we can get people vaccinated in 2 weeks rather than waiting 4 to 6 weeks like with Pfizer and Moderna.
Johnson & Johnson. We said it from the beginning.
So Dr. Kohli, now that we have 3 vaccines to choose from, are there realistic advantages for certain people to get certain vaccines? I know you're telling your family to get any one available, but is there a reason why somebody would get a certain one?
Good call.
Yeah, so I would say, Lindsay, only if you've had an allergic reaction to a component of one of the other vaccines would you go for one or the other. They did look at subgroup analysis, so they broke down the pie into smaller subgroups. And with Johnson & Johnson, those over the age of 65 with medical problems or those with HIV, they still need more data on. But really, you can get any of them. And I want to be careful not to compare the numbers head to head, because we're actually talking about 2 different time periods. Last year, when we studied Moderna and Pfizer, we didn't have the variants. And it's possible that if we studied them now, like we did Johnson & Johnson, their performance might change because we now have the variants. So, we have to be careful about saying one is better than the other. They're all really good vaccines, and we just have to get that vaccine as soon as it's available to us.
I just remember meeting Dr. Kohli, and from then till now, where we have 3 is a big step. So let's all be grateful for that.
That's right.
And be grateful for Dr. Kohli just as a person, because she's wonderful. Thank you so much, Doctor. We'll be right back.
My girl.